Hello, I'm Lumi, your virtual care assistant from ABCD Pediatrics. I'm here to help gather some important information for your provider, and I appreciate your cooperation. If you need clarifications, or want to skip a question, or need to pause this interview, just let me know. Please confirm the patient's name and date of birth.
I'm her father. She's my daughter, Emma. She's 6 years old.
What symptoms is Emma having?
She's been complaining about her ear hurting, pretty bad actually. She woke up crying last night, and she's usually a tough kid, but she has been really miserable. Won't eat much either.
Please tell me about when the symptoms started.
Yeah, let me think. It started, I guess, Tuesday evening. Yeah, Tuesday after dinner, she mentioned her ear felt funny. Then by bedtime, she was saying it hurts. And well, yesterday it got worse throughout the day. Today it's been rough.
How severe is the pain?
Oh, it's pretty bad. It's pretty bad. I would say, I don't know, maybe 7 or 8. Um, she was crying, 7 or 8 out of 10. She has been crying last night and couldn't sleep, even with the children's Tylenol. She's still, holding her ear and whimpering. It just looks pretty bad. It felt bad.
Is the pain in one ear or both ears?
Just 1 ear, her right ear, she keeps pointing to it and won't let us touch the side of her head.
Does the pain worsen with chewing or swallowing?
Yeah, actually, she wouldn't eat her breakfast this morning, said it hurt to chew. Even drinking her juice seemed to bother her. She kind of winced when she swallowed.
Does Emma pull or tug at her ear?
Oh, constantly. She's been tugging at it since yesterday. We keep telling her not to, but kids. She says it feels better when she pulls it on it. Dad, little bit. Can I pull it? But yeah, we couldn't stop.
Has there been any discharge from her ear?
Nothing that we can see. Nothing comes out. I checked this morning and I put a torchlight, and with the torchlight, I was just looking at her ears. Because my wife thought she saw something, but it looked dry and scaly, no fluid or anything like that.
Has Emma had a fever?
Yes, she has. She started last night around maybe 10ish, 10 o'clock in the night. I know we took her temperature and it was like 101.2. Yeah, 101.2 this morning. It went down a little bit. In the morning around 9 o'clock, it was 99.8. And then after lunch, it went back up above 100. Was a little bit below 101. I think it was 100.6, something around that. We have been giving her Tylenol, 3 times, 4 times a day. Yeah.
Has Emma had a cough, headache, or nasal congestion?
She's had a runny nose for probably 4 or 5 days now. And she mentioned her head hurts yesterday, but I thought that was just from the earphone. No cough though. Well, maybe a little one in the morning, but no, nothing serious. I mean, she was sneezing and a little bit of cough, but yeah, nothing serious.
All right, that concludes the questions I needed to ask. This information will be passed on to a nurse, and you will be contacted by the end of the day for further instructions.